Throughout history, immigration and the movement of people have brought not only cultural exchange but also new challenges, including the spread of diseases. One of the most devastating examples of this is the Black Death of the 14th century. The pandemic, which killed an estimated 25 to 50 million people across Europe, demonstrates how easily diseases can cross borders, especially when populations lack immunity. The Black Death, or bubonic plague, originated in the Central Asian steppes, an area controlled by the Mongol Empire. It was carried to Europe via trade routes, primarily by fleas on rats that infested merchant ships. The Mongol invasions of the 13th century unified vast territories, creating the Silk Road and other trading networks. While these networks facilitated the exchange of goods, they also made it easier for diseases to spread. One notable event during the Black Death's spread is the siege of the Crimean city of Kaffa in 1346. The Mongol army, suffering from an outbreak of the plague, allegedly catapulted infected bodies into the city. From there, the plague spread rapidly through trade ships to Italy and across the rest of Europe, leaving devastation in its wake. European populations had little immunity to the plague, which made the pandemic particularly deadly. With no medical understanding of the disease, European societies were overwhelmed, and the consequences were disastrous: mass deaths, labor shortages, and economic decline. Now, while the Black Death is an extreme historical example, it still offers important lessons for today. Global migration, much like trade in the Middle Ages, can introduce diseases to new regions. Immigrants may carry pathogens from their home countries to Europe, where the local population might not have immunity. Diseases like tuberculosis, measles, or even tropical illnesses such as dengue fever or malaria are of concern, especially when immigrants come from regions where these diseases are prevalent. At the same time, immigrants themselves are often vulnerable. They may lack immunity to infections that are common in Europe, making them more susceptible to illness. This health disparity underscores the need for strong healthcare systems to manage both the spread and treatment of diseases within migrant communities. Thankfully, today's healthcare systems are far more advanced than they were in the 14th century. Vaccinations, public health monitoring, and quarantine measures are in place to manage and contain diseases. However, as we've seen with the recent COVID-19 pandemic, global travel and migration still present significant challenges for controlling new or mutated diseases. The key to preventing future outbreaks lies in global cooperation and vigilance. Both migrants and host populations need access to healthcare, and public health systems must remain alert to the possibility of emerging or re-emerging diseases. In conclusion, the spread of the Black Death through Europe in the 14th century serves as a powerful reminder of the dangers posed by new diseases introduced to populations without immunity. Today, migration could similarly bring unfamiliar diseases to Europe, but with modern health measures and global cooperation, the risks can be managed. However, we must remain watchful to prevent and contain future disease outbreaks.